Hmm. Hmm. So, hello friends. Today again I am there with a live video on breast augmentation. So, this is, as I have already put on my story, this is a case of breast augmentation with silicone implant at the same time your fat grafting. So, this is what we call hybrid breast augmentation. Okay, now let me tell you something about this. I mean, this lady, she's a lady in her early 30s. She has got little sagginess in her breast. She wants to enlarge it, but yes, she wants to do tummy liposuction at the same time. So what we have planned is hybrid breast augmentation, which is a very favorite procedure of mine. What we do is we do tummy liposuction. We harvest the fat and we process it and we put it inside the breast. Now, along with this, we put the silicone implant also. Now, how do we do the procedure? First, as conventional anesthesia, after general anesthesia, we prepare the area, we do the markings and all. Generally, the marking is also done in standing position. We corroborate the marking on table. Now, the first step is to make a small cut below the breast so that the scar gets hidden. And the first step is to create the space for the implant. That is what we call pocket creation. Now, that is what I am doing now. I am in the midway of it. So, this pocket which I choose. This pocket which I choose is subfascial. That is below the gland, below the fascia. There are other approaches like below the muscle, then below the gland, but the pocket which I choose, the plane which I choose is subfascial, that is below the fascia of our chest. You have to be very careful about the hemostasis, that is the bleeding, just to avoid post-operative infection and blood collection. I'm almost done. If properly done, it takes just 5 to 10 minutes to create this pocket. Now, the second, this is the implant which I have chosen for this lady. The size of the implant is a big question, like which size to choose for which patient. This is a customized thing, as I have discussed in other videos. Now, this lady, as per her expectation, as per her requirements, as per her chest diameter, as per her cup size, we choose the size of the implant. Generally, what we do is we take pictures on various angle, we put it into a software, then we calculate the size of the implant. Now, this particular implant has been already, as you can see, has been already soaked in normal saline and antibiotic solution. So, this is the implant, you can see, this is the implant. As you can see, the size is mentioned, it's 415, that is 415 cc. This is the volume of the implant. Now, the characteristic of this particular implant is it is smooth. The other variant is textured, nano textured, and it is a round implant. The other variant is anatomical. So the implant which I have chosen is 415 cc of round and smooth silicone implant. Now the pocket is already done. Now after I have soaked it in antibiotic solution for some time, I will be putting it inside the pocket. So this is what the second step is all about. Now after I have put the implant into the pocket, my last and final step would be to close it. Now this closure is also very important. We generally close it in layers. First the fascia, then the fat layer, then we do running intradermal stitches. So I will be taking you through the next steps. Now in between, if you feel to ask me any question, you can go ahead. The purpose of doing these videos are just, I keep getting many messages on breast augmentation, fat grafting and all. So you can feel free to ask me questions. I know the time is early morning, so couple of my friends are not live. I mean, they're not there to see me, but you can question me in my inbox also. So this is the implant. You can see I'm squeezing it, I'm pressing it hard, it is coming back to its shape. This is the uniqueness of the recent generation silicone implant. Mind you, this implant is not going to break, tear that easily. This is a common myth. I'm squeezing it very hard, I'm putting enough pressure, but as you see, it is coming back to its shape. So don't be in a myth that the implant will break, it will tear off. Why will I use implant? Why not only fat? Fat is a good option. Definitely, it's one of the best options for breast enlargement. But this is something which gives a better result. It gives you results immediately. So I'm going ahead with my second step. So as you can see, I'm gently putting it inside. If at all I feel resistance, then I have to increase the size of my pocket. Many a times during insertion we get resistance. So what we do is we increase the size of the pocket. As per my planning, the pocket had been adequate. So there had been no much struggle. You could see me smoothly putting it inside the pocket. I'm just placing it properly. Yeah, done. So this is my second and most important step of breast augmentation, that is placing the implant properly. This is one of the key step of this surgery, placement of implant. The implant should be placed smoothly, snugly, and it should not be floating. Like there are some cases I have seen, after implant the implant is moving all around. So this is because of making a pocket which is larger than the size of the silicone implant. So after this, this step is done, the final step, again I'll check the bleeding areas. Once I'm happy with the bleeding areas, it's secured, I will be closing it. Now closing is also very important. Now everything said and done, I will now start doing the tummy liposuction, where I will be taking out fat and I will be designing the cleavage. So this is what is known as designing the cleavage, to get a proper and well defined cleavage. So this entire procedure is known as hybrid or combination of implant along with fat. So I am using an absorbable stitch. This is again another very important question people ask me. People ask me like, do I need to take off the stitches? Since I get many patients who are outside Kolkata, they keep asking, what about my stitches? So let me tell you something. The stitches are generally absorbable. We don't need to cut. Yes, yeah, I'm coming to some of the questions. Can you come a little close? Hello, yeah. How much time does it take? Are you asking about the surgery? The surgery takes, all taken together, 1 hour, but if I'm combining some other procedures like liposuction and all, it takes some more time. Yes. So I've started my closure. As I told you, this closure is equally important. Cover करके रखना. And another very commonly sent message to me regarding this surgery is, what about the scar? People are scared of having this procedure done because they are scared of getting known even by their partner also. So let me tell you something frankly about it. Yes, there will be a small cut, but this particular cut heals very beautifully. Immediately after the procedure, immediately after the surgery, in initial few months, you may find it little awkward, but eventually if the scar creams and all are used properly, this is nowhere noticeable. So don't be scared of the scar, and if you want to get a new shape to your breast, then you would not get a better procedure than this. The other side of the, the other side has been already done. The implant insertion is due. So I will again show you how I put my implant that side. The pocket creation has been already done. I was little late again to start off my video. I'll come to the other side. My closure is almost done. ढक के रखो. I cannot see. Hi Soumya, is it very painful after I look, any kind of surgery, after the surgery is over, you'll have little pain, but trust me, the pain is well taken care of. You will be put on enough painkillers to for you not to have pain. So pain will not be a concern. Yeah, definitely post procedure, a common complaint is heaviness. So initially after the procedure, you'll find little heaviness in your chest, which also heals eventually with time. हाँ, मत ये तो nipple guard करो. Now there are such, no, it's okay. I checked it, it's fine. Now there are other approaches to put implant. That is, one is through the nipple, the other one is through the armpit. Now, honestly speaking, I don't do these approaches, but yeah, there are surgeons who do it. My approach is always making a small cut below the breast, and I feel I deliver good results with it. So this is the approach which I follow. Now, the common myths, as I discussed 1 or 2 days back on live, was that breastfeeding and all, these are very popular myths. There are thousands of myths about the surgery, but I guess this is the commonest one. There will be any problem in breastfeeding. So as I discussed during the procedure, the plane of my implant placement is below the gland, below the fascia. So the gland is intact. So there will not be any interaction with breastfeeding. So this is a big, very popular myth. Now I'm going to the other side. My implant is already ready with antibiotic solution. Closure is almost completed. Now after the surgery, what we do is, let's go to the other side. So after the surgery, what you prepare, huh? After the surgery, what we do is, take the light. So after the surgery, what we do is we put a tight jacket that is known as compression jacket. Basically, it's a sports bra. So this has to be there for some days. I'm going to the other side. Now, once again, I will check the pocket whether it is adequate or not. No, it's okay. That আমি পাটা একটু করে দাও না। So my space is adequate. My implant, again I will show you as a recapitulation. See this implant. It's a beautiful one. When we started doing breast augmentation surgery long back, this was the first thing we used to do. We used to prepare and we used to roll it like this. This gives you a different kind of satisfaction. So this is my implant. You see the volume, again check it. It's the same size, 415. It's a smooth one which I discussed just few minutes back. And again, just for your recapitulation, see this, pressing it hard, squeezing it, it's all fine. So this is coming back to its shape. So this is something which can bear a lot number of forces all taken together. Look, now again, as I discussed, I will be putting the implant. If I find resistance, if the implant doesn't go smoothly, then I have to little increase the size of the pocket. So here I go. My hands are slipping. This happens because of the normal saline. This side I am finding little resistance. I may have to increase the size of the pocket, but let me see once. Yes, little resistance on this side. Let me further try. Yes, try till you succeed. I succeeded. So my pocket was adequate on both the sides. Yes. Yes, done. So can I have a mop? So my implants are snugly fitting. It is comfortably placed. Can I have a mop? So it is comfortably placed. Now, as I did on the other side, the same thing, I'll be closing it. So this comprises my breast augmentation with silicone implant on both the sides. Yeah, take it off. Now, the second step of the surgery, as I discussed before I started the video, that is my tummy liposuction, where I'm going to take little fat, as she desires to take off some inches on both the sides. She is doing regular gym and all, but she wanted from her love handles little from the lower tummy. That fat will be processed and will be injected into her chest. Mainly what the areas which I'm going to inject is the cleavage area. I'll be choosing, I mean, I will be taking 150 to 200 on each side. So this is what is breast augmentation with silicone implant and fat grafting. So this video I will be only showing you up till the breast augmentation with silicone implant. The tummy portion I may not be able to show you because of some logistic issues. So till this step, if you have any question about the procedure, any doubts you have, since I receive a lot number of messages regarding this procedure, and that is why on two consecutive days I am coming up with this live video. Since many a times I fail to answer, my team also fails to answer many a times. So this is the best opportunity for you. I know the time is early in the morning, but as you all know, I operate generally in this particular timing. 20 Victory. So I'm starting with the closure. Diathermy. Diathermy भाई कैंची हटा. So in between the surgery, I mean even during closure you may find little bleeding. So you have to be very meticulous about this. As you saw, I was about to start off my closure, but I had to again cauterize. So this is a device which we use for checking the bleeding. रुक जाइए यहाँ पे. Though it's a very simple surgery, but you have to be very meticulous about it. You have to be very meticulous about the steps. Since this lady has to bear this implant for rest 15-20 years, so each and every step of your procedure is important. Can I have another one? Caesar. Please feel free to ask me questions. If at all you are watching me, please feel free to ask me questions. Because of some restrictions on Instagram, I'm not able to show you the exact, I'm not able to show you the entire structures. I wish Instagram takes off this privacy thing, then I can show you each and every step in detail, but as luck would have it, we don't get that kind of privilege to show each and every step. Given an option, I would post videos on breast every day, but it's not possible. Right, 20. Okay. So as you can see, I'm using this stitch, which is an absorbable one. Now I keep getting one question on my inbox. There are females, there are men who want to increase their size of breast, but they don't want to go for any kind of surgery. Rather, they are scared of getting under knife. Look, I'm a plastic surgeon. For me, the best possible option would be surgery. And why I would offer that, the reason, it is the gold standard worldwide, not only in India, everywhere, be it US, be it anywhere you want to increase your size of breast, surgery is the best option. Now, which surgery you are choosing, this is a customized thing. This, as I discussed, it depends on your expectation, your existing cup size, capability of your surgeon, which procedure he prefers. So these are certain things which needs consultation. Sending a message and asking for estimation at times becomes difficult. The only reason, what you want to have, this I need to know. What what is the size which you are looking for, what is the kind of cleavage you are looking for, what procedure you want to go for. So this needs a discussion face to face, or whatever source it is, that clears many doubts, that gives a clarity to both the parties. So I would suggest, if you want to go for this procedure, you're craving to have a nice breast, please have consultation with the plastic surgeon. He will be the best person to guide you. Yes. Hi Sneha, can you please tell me that you? Yes, I do. I do definitely. I mean, I do this xanthelasma thing, but I would rather prefer to discuss about it in a different video, or you can directly message me. You can message me on my clinic page as well. You'll get an answer. Or if you are staying in the city, you can come down to my clinic and see me. Excuse me. And something regarding the exercise and doing gym after the surgery. Look, there are some surgeons who prefer mm, asking their patients to rejoin their gym and all after a week, but what I follow is after at least 2 to 3 weeks. I go little slow. I have my own reasons for it. So I ask my patients to join gym or any kind of strenuous activities at least after 3 weeks. We generally do it as a daycare kind of thing. This lady got admitted in the morning, we are operating by afternoon, she goes home by evening. For my outpatient patients, many a times I keep them admitted, but that is for people who are coming from outstation. I guess it had been an informative live video. So, any more questions? You can drop it. I will definitely come back to you. I'll come up with many more such videos, but my apologies. I operate in the morning, so I miss on too many viewers, but I cannot change my routine. My routine is to start off the day with fresh mind and operate. I don't prefer operating after afternoon. I generally keep 2 3 surgeries every day, at times 4 5. So here it is, the closure is done on both the sides. Now the last step, that is last not but the least, that is dressing. What I do is we put small little adhesive bandages. They're very beautiful, they look very nice on the breast, and then we put a compression dressing, and on top of it, as I discussed, this sports bra. This is very important. This keeps, this keeps the breast in, the implant in place. But the dressing will not be done now, as I told, I have to do another procedure, that is the harvesting of fat. I could do both the procedures together, but as I am on live, this would be little difficult for me to interact with you. So I'll start off with the next session of my surgery. So that's for all. Keep watching me, keep liking my videos. See you.